Thank you.
So first of all, I want to thank the organizers for inviting me to be here. I'm really looking forward to chatting with you all. This is some work that we're doing, trying to think about how we conceptualize and measure hyperpolicing and how we can use it in public health work. No conflicts. So this work started for me following 2020 when there was this kind of increased kind of idea of policing as a political strategy for many folks who are running for office, following many of the high-profile police killings that took place through kind of the 2010s, and then in 2020, you saw this reemergence of, following the calls to defund police, you saw this kind of recommitment to actually further police budgets, further police presence, despite the fact that many folks within communities were very much against this idea. And there's strong reasons why folks were against this idea. There's a lot of evidence that suggests that criminal legal system exposure and policing specifically have negative consequences for a number of public health indicators. So when we think of incarceration, there's a whole litany of work around mass incarceration and health, and we've seen associations with communicable diseases, chronic physical morbidity, poor mental health, increased fatal overdose risk. But even when we think about policing, and so what I'm kind of distinguishing here, so incarceration, obviously the idea of actually being physically detained, but policing is this interaction with folks, whether or not you end up arrested, whether or not you get detained, right? And so even just exposure to policing has been associated with psychological distress and depressive symptoms, injury risk, mortality risk, especially understanding that 1 in 5 police shootings victims may have been experiencing a mental health crisis at the time of that shooting really underscores this idea that not just that there's consequences of policing, but that the way it's being distributed is unequal and in ways that can be somewhat predictive. But so if we fast forward now, and frankly this is stepping away from parental leave to prepare for this conversation, I had to kind of resituate myself and realize we moved from this idea immediately post-2020, where it's this idea of politicians really pushing for policing, mostly in the local space. Obviously, as Dr. Bassett alluded to, we're seeing it very heavily in the federal space now, right? With all sorts of calls for federalizing police forces and putting, not just kind of federalizing the local police, but actually putting militarized individuals, militarized forces in these cities. And as Dr. Bassett alluded to, yes, many of these cities have black mayors, black executives, but also in many cases, the targeted cities themselves are predominantly black and brown, or at least have very high concentrations of black and brown individuals. That's not surprising when we think about even on a more granular level, there's strong evidence around the racial inequities around criminal legal system exposure. So an example, and this is on the figure in the right, this is thinking about arrests for cannabis possession. So data has been shown time and time again, especially from National Survey of Drug Use and Health, that black and white folks use cannabis at roughly the same rates. Nonetheless, we routinely see black folks policed and arrested at considerably higher rates than white folks. And so this figure essentially is just showing that at the state level with the darker shades of red illustrating a higher black-white ratio of arrests for cannabis possession. And the thing is, though, these higher rates of policing and arrests then also impact your risk for these kind of consequences of police and criminal legal system exposure. So this figure on the right is past year police violence exposure by race ethnicity among a sample of New York City residents, and it's split up by both race ethnicity as well as kind of type of police violence, and seeing that for every violence type, black and other folks of color experience higher risk of violence. And this is directly coming off the consequences of also being policed at higher rates. And highlighting this fact with the idea that black men have a 1 in 1,000 chance of being killed by police. So even within the concept of the distribution of policing and the consequences of policing, we see routinely that these things are not experienced equally or equitably across groups. And so this brings up this concept of hyperpolicing that often gets discussed. So hyperpolicing can be thought of as the extraordinary and aggressive levels of police attention that get directed towards either specific groups or specific communities. It's often enacted through kind of this heavy surveillance or enforcement of what oftentimes we might think of as quality of life offenses. So things like loitering, or in New York City, fare evasion is, public enemy number one, apparently. And so the thing is, when we think about hyper-policing, and specifically the work that's been done to show the consequences of hyper-policing on public health, that literature has not been fully characterized, right? And I think there are a number of reasons why that may be. So one thing is that I think the construct of hyper-policing isn't necessarily an individualized exposure, right? So, and what I mean by that is a person does not have to be the individual who is specifically stopped and frisked to feel the consequences of residing in a neighborhood in which that is a constant threat, right? And so thinking of ways to capture that becomes a meaningful part of this. But also, there are few kind of quantitative assessments, at least that I've come across in the epidemiologic literature. I think that's for a couple of reasons. For one, the conversation around hyperpolicing is often, I think, characterized more qualitatively, right? It's something that we can describe what it looks like, we can describe what it feels like, but in epidemiology, we like something that we can put a quantitative value to, right? And it's not to say that those do not exist, but the way that those are operationalized vary quite a bit over the literature, and there's yet to be one that I think really kind of dominates as something that you see consistently and applied in different spaces. So we got pilot funding to try to do just that. So we really had two main goals with this pilot. The first one, we wanted to create a database of geocoded policing encounters. This is using data from the NYPD. And I say encounters or exposures because we really want to focus on the idea that if we're concerned about the consequences of hyper-policing, it's not just about who gets arrested, right? We often say that arrests are really just the tip of the iceberg. So for every person out there who has this consequence, this encounter with the police, whether they're stopped and they're frisked, whether they receive a criminal court summons that they later have to go and kind of handle in court, whether they're arrested, all of them have potential kind of negative consequences of that experience. We want to highlight that. And we wanted to think of what it would look like to develop an accessible quantitative measure for racialized hyperpolicing. We're doing this at the census tract level, but something that is easily understandable, easily implementable, and something that other researchers could use as well. So for this, we compiled geocoded data from the NYPD Open Data Portal. We use data from 2010 to 2014. Again, so we have different data, kind of data sets for arrests, criminal court summons, police stops. We aggregated all this into the census tract level. We linked it with demographic data from the American Community Survey. And then we constructed this kind of quantitative hyperpolicing measure that we're currently calling this Policing Disparity Index. I'm not clever enough to come up with a better name, so that's what it is for right now. Essentially what it is, it's just the proportion of these kind of police encounters for a specific racial ethnic group minus the proportion of the population of that group that lives in that census tract, and we'll talk about that a little bit in a second. And then we took that and some other things and we built a publicly available interactive dashboard, and by we, I mean Nora Kelsall, who is a fantastic doctoral student who works with me. So this is kind of a snapshot of what Nora's built, because she's fantastic. But essentially what this map is, it's a tool that folks can go to. They can look across the city, across the 5 boroughs, and they can play around. So the data goes from 2010 to 2024, so they can look over time. They can play around whether they want to look at total numbers, whether they want to look at specific racial or ethnic groups. They can look at arrests, they can look at stops, they can look at summons, they can look at combinations of them if you want to get like a total picture of all of the kind of policing encounters. And then we have different measures that you could use. So you could look at the raw counts, you could look at rates, or you can use this Policing Disparity Index that I'm going to talk about. So again, we tried to be real kind of simple and straightforward here, but what would it communicate the message we needed to communicate? So again, with this idea of the difference between the proportion of the group that's experiencing the encounter versus their proportion within that census tract. So for example, if in a given census tract, 20% of the people arrested are white, but they make 40% of the residents of that census tract, you would have a value of -20, right? Conversely, if it's a census tract where 60% of the arrests are of black folks, but black folks only make 40% of the residents of that census tract, you'd have a 20 for your value. And essentially all we're trying to do here is to highlight this kind of relative disproportionality, right? So where the scales equal versus where they tilted one way or the other. And hoping in doing so we can convey a message that is not just understandable to those of us in this room, but also folks in the community who just want to play around with this and get a sense of what the burden is in their neighborhoods. So this is an example of what these maps look like. This is using the data for arrests in 2024. Essentially here with the idea that these kind of purple values are showing a negative disparity. So these are the folks who are essentially policed less than their representative amount based on their how they reside in that census tract. The red are those who are policed at a higher level. And we can see, so moving from left to right, the maps for white individuals, black individuals, or folks who identify as Hispanic or Latino. And what we're seeing is, yes, you can picture global patterns, right? So there's a lot of purple in the white map, there's a lot of red in the other two maps, but also across the city, the level of that burden changes, and that's something that we're really interested in trying to understand. So, for example, if I were to hone in on this kind of strip here, for folks who are not familiar, that's part of the neighborhood of Washington Heights. It's where the Columbia Medical Center is located. And so I see for white individuals in that neighborhood, their value was a -67, suggesting that they are experiencing arrests at a much lower level than one would expect if proportional for how many folks reside there. For black folks, it was a -0.91, so about neutral. You would argue that for black folks, it's at least going just on their kind of how many folks reside there. It's about proportional. For Hispanic folks, Hispanic Latino folks, they had 89.67. So this is a prime example where we could say, okay, like this is a group that is being dramatically hyper-policed in this neighborhood relative to what we would expect given how many people reside there. And so in terms of different applications, this is just an example, and this is a paper, again, that Nora is working on now, where she is looking at median household income to try to see to what extent that may predict the level of disparity across the city, because as we showed in the earlier maps, like yes, I can see that across the board, there's a lot of red for black folks, but it varies, right? So what is predictive of a neighborhood that has especially high racialized hyperpolicing for black folks versus others? And in this case, looking at median household income, she found a positive association that suggested that income does have some impact on the magnitude, but it wasn't equally distributed across the city. And there's a positive association in higher income and more central areas. So we can then think about, okay, what are our next steps for that? How do we interpret that? What might be in part driving these type of things? So, you know, our ongoing work here and what we're really excited about doing is taking this tool, linking it with different type of health income data, because again, what ultimately we want to understand and better characterize is the impact of hyperpolicing for health of these communities, because what we really want to highlight is this idea that using the idea of throwing policing at people as a kind of political tool, forget the, like, yes, I understand people want to feel safe. I know that was highlighted by a person earlier in this presentation, but understand that these decisions have other consequences as well. And we feel like that needs to be documented, and that's what we're hoping to do here. We're also working to add additional data layers to these maps. I'm working with Dr. Seth Prins, who has access to, for example, density of school resource officers. Ignore that typo. I saw it, but it was too late. And so thinking about all the different ways that we can get a fuller picture of what's happening within these neighborhoods and how that's influencing what we're seeing in terms of policing and downstream health outcomes. And also, part of the idea behind this work is to create a measure that can be easily applied to other data as well. And so we're thinking about what are other jurisdictions, what are other municipalities where we can have data, where we can look at that and look at differences across that time. Limitations, acknowledging, this is, at least in current state, reliant on administrative data, and in our case, administrative data that's collected directly from law enforcement. So we understand that there are potential limitations that we need to be acknowledging in that. And for our map in particular, it's frustrated that the criminal court summons data basically has no racial ethnic information, so we aren't able to use the tool for that measure in particular. But with that, I want to acknowledge the collaborators who've helped put this together, funding both from my pilot as well as Seth's R. There's a QR code for anyone who wants to play around with that mapping tool. Please do. We want to really make this something that's accessible to all, and especially not just researchers, but folks in the community. And yes, my newest research assistant who helped me put these slides together. So, thank you.